My name is Anne Bracken. I'm here with Zevo Health as part of the webinar series to support nurses and midwives in their day-to-day lives. Today's webinar is about managing yourself in those busy, chaotic environments for nurses and midwives to be able to support themselves in the here and now moment when emotionally triggered or when they're faced with a difficult or very busy situation. These series of webinars are available on the Let's Talk About It series with Cornmarket INMO. And there are a range of webinars in the series, and today's one will look at how to support yourself psychologically, how to support yourself emotionally and physically. And other webinars, we also go into more in-depth around how to change our thinking when faced with triggering situations with CBT, and also how to support yourself with mindfulness. And there's also webinars on how to build resilience and manage our own day-to-day lives and create that work-life balance also. So today's webinar will explore the versions of stress that we can experience in our day-to-day life. So not all stress being bad stress, we can have eustress, which is actually really helpful for productivity versus distress. And when do we notice those symptoms internally and how we feel and also our thinking or what we might do or not do because we feel that distress. We look at building resilience and how to support the nervous system with an approach which is called the window of tolerance. So how to increase our tolerance in difficult situations by first of all recognizing the type of things that trigger an emotional response versus, or indeed which may trigger that emotional shutdown, and how to create that balance again internally and also in our communication with others. And that's also supported by psychological flexibility. So we look at how to support approaches which allow us to notice our thinking and consider the different perspectives, but also be very present to the here and now moment, rather than maybe being informed by similar events in the past and making assumptions about ourselves or others in the situation. We look at our personal values and our choice points for change. So when we want to change, for example, maybe we want to support our physical health or our psychological health, or we might want to support a change in our nutrition or diet. And we'll look at how maybe those areas that we might want to focus in on a little bit more to create that balance. And then in relation to those areas, we'll look at 5 steps towards overall health, including looking at a healthy sleep routine, at nutrition basically, and the importance of exercise and present focused activities to help create that emotional balance and that homeostasis in our physical self. So what is eustress and versus distress? Well, eustress is defined as positive stress because it's that type of motivating stress that is required for performance, for example. In a busy nursing environment, it's about how prepared you are, and naturally it's about ensuring that, you know, CPD and all these things are up to date because you feel motivated and stimulated by this eustress to perform and support yourself with task-focused thoughts. And even in a busy environment, it actually creates that energy to do so. It's not harmful and it's short-term, and it generally has the following characteristics. It tends to motivate us. So otherwise we'd feel apathetic and we'd just feel, you know, that we're not that engaged, we're not that interested. But this type of stress is motivating. It releases energy and it's focused energy, so we can keep our thoughts focused on the task at hand. It's also short-term in nature, and it's perceived to be manageable stress. It's not overwhelming. It actually feels exciting. So I'm sure you're very well used to that type of eustress. And overall, because it focuses the mind, basically it improves performance as well. Now, when we move into distress, it's a very different type of feeling. And of course, we've all recognized when we feel distressed, it's more characterized by a feeling of feeling overwhelmed. And especially when that is repeated over and over, it has a physical toll, a psychological toll, and an emotional toll on our overall well-being. So distress is considered negative as it usually leads to ongoing kind of psychological problems, such as anxiety or indeed low mood or depression. And sometimes with that anxiety, if we feel overwhelmed, we can perceive that, you know, the task won't be done properly, that in some way we're going to be discovered that we're falling short of what's needed. We begin to think lots and lots of hypothetical worries, as opposed to what's the real problem here and what action do I need to take to support myself through this. Instead, it's based on this ongoing worrying and this catastrophizing, all or nothing thinking, and generally hypothetical worries. What if this happens, and what if this happens? And we overthink things in that scenario. It has the following characteristics. It tends to be longer term. So longer term distress then overspills into anxiety, which could be generalized anxiety, where we're anxious about relationships, we're anxious about our communication, we're anxious about our productivity, and we're anxious maybe also in relation to external relationships. So it covers all areas. It can also contribute to low mood because there's that sense of overwhelm, and then physically you can feel really exhausted from that overthinking. And very often with that anxiety, you can also have that low mood or depression where you feel it's all a bit hopeless, and I feel helpless in the face of this chaotic or busy environment, and a feeling of not being able to cope. Now, it generally lasts longer, but it can be short term. It can be a really intense, high stress situation where you perceive it as outside of your coping abilities. Naturally, it decreases performance because it's very difficult to focus on the task at hand. So instead, there's this constant thinking about other issues, potential issues. It can lead to physical and behavioral problems. So a buildup of stress in an ongoing basis can lead to heart-related issues. And actually was a cardiologist in Harvard University that discovered the link between increased heart problems, cardiovascular problems, and the level of ongoing stress that people were experiencing. And he then discovered the idea of fight, flight, freeze. 50 years later, in the same room of Harvard University, Herbert Benson discovered that, in addition to this fight, flight, freeze, heightened, stimulated nervous system, we also have, which is the survival approach, we also have the ability to be able to call and activate our parasympathetic nervous system. So that rest and digest in order to support the systems which are basically overloaded when we have ongoing stress. So ongoing stress can, as I said, it can lead to, or certainly contribute to, heart-related issues, blood pressure, digestive problems such as IBS, blood sugar imbalances, and also it affects the endocrine system. It can lead to behavioral problems such as problematic emotional eating, or problematic alcohol abuse, maybe increased smoking, or indeed social isolation, which is definitely an ingredient for depression. So there's that sense of, I don't want to engage with people, I can't connect with people right now because I'm feeling so different to how they're feeling. Perhaps with that anxiety comes that comparing and contrasting. So this nurse, this midwife is much better than me, I can't do this. So a lot of internal criticism and a lot of comparing and contrasting. Naturally, with those situations, that leads to emotional consequences, and that can mean that you feel quite tearful, maybe frequently crying in the workplace setting, and then of course being very critical of yourself and feeling that you're not professional. And all of these things escalate the thoughts, escalate the emotional response, escalates the thoughts, and that influences what we'll do or what we'll avoid doing because of it. So when we're emotionally overwhelmed, we can have that sense of shutdown. So there can be that disassociation or emotional numbness, a disconnect. And with that, we can find it hard to have that empathy, which is necessary, of course, in those supportive roles, such as nursing and midwifery. You can feel basically emotionally disconnected from close family friends or from colleagues, or it may manifest as a need to be constantly reassured. So rather than trusting your own ability, your own professionalism, your own understanding, your own skills, you might begin to really doubt yourself and need this constant reassurance. So this stress then can overspill into anxiety, which again can overspill into that sense of low mood or depression. So how do we build a resilience then? How do we increase our ability to cope with these challenging environments? And one way to build resilience is actually to identify, well, what is in my control and what is outside of my control? What am I responsible for? But equally, what am I not responsible for? When we try to over control everything, we tend to talk to ourselves and other people with lots of shoulds. I should be doing this. It should be like this. They should be doing this. And it can get very demanding. We can end up micromanaging ourselves, micromanaging other people, and not letting go a little, going with the flow a little bit more, surrendering control where it's something that you're not responsible for. So surrendering control is not saying, I don't care. It's basically not trying to take action where it's not, there's no required action to be taken. So increasing your window of tolerance will support you to make changes outside of your comfort zone. There are naturally limits to our own personal control in any situation. So we may have some control, other people may have control, the patient may have control. So what's within our control, what's outside of our control? We cannot fully control, for example, how other people will react to us or what they will think of us. We can't control certain thoughts from occurring, or we can't actively control the time we fall asleep. We need to be more accepting of those things that are outside of our control rather than an internal must do, have to, should do dialogue. So a current example could be, we naturally, for example, if we accept that we don't like COVID, however, we can manage to live with the situation until it passes, well, then we're more likely to experience concern. However, if we catastrophize and if we have low frustration tolerance, we would say something like, it must change. I can't cope with this. I've really had enough now and I can't stand it. And that naturally increases that internal stress. So we begin to, instead of feeling concerned, taking the right precautions, we basically experience anxiety and may isolate and feel overwhelmed. So in terms of this idea of surrendering control, in these situations, the only way to enhance personal control is actually by letting go. So that's a paradox, the paradox of surrendering to it is as it is right now. What action do I need to take? What do I need to let go of? What's in my control? What's outside of my control? Or what do I have very little control around? So rather than trying to control the uncontrollable, surrender involves noticing that there is nothing one can do to change this particular situation. Now, it's not to be confused with being apathetic, like, giving up. It's not about giving up. It's basically about increasing our tolerance level. So accepting that this is a challenging situation, this is a chaotic situation. What action can I take? How do I contribute to this? How do I lessen this? But not try to control every other variable of the situation, which can happen when we feel anxious or stressed. So it's basically an active way of identifying what action you may need to take and what action you need to let go of. And then it could just be that this is a really chaotic time. I can do what I can do, but I also need to engage with self-care practices to support you through a particularly challenging environment. the more resilience or the more resources we have, the more the challenging situations have a context, a wider context of self-support. So if you're resourced through self-care and self-support, you're less likely to be triggered straight away into high stress and anxiety. However, if you are emotionally exhausted, if you're very fatigued, then obviously you're more vulnerable to being triggered into that stress reaction. So when we look at control and where we have control, where we might not have control, so our points of power, it's important to tune into these, particularly if you're used to working as part of teams in a busy environment like a hospital or medical setting. So you have control over your own priorities, as in your list of what you need to do, your mindset, so how you approach those tasks, your actions, what you're going to do or not do, and of course your best effort, as long as we're not physically ill. You have some control, some moderate sense, maybe even minimum control over your schedule as it's allocated to you. Your health routine, you have some control over, but of course there's other aspects that influence that as well. You have some control over your home environment, but if it involves other people, you don't have total control. And you have some control over your support team and your colleagues and how you interact with each other, but not total control. And what do we have no control over? So be aware that we need to be psychologically flexible around the areas that we have some control over. We can assert control over the areas that we do have control over, but it's important to be aware of what we don't have control over and what we need to work on accepting or letting go of or adapting to or moving away from. So we don't have control over politics and world events. We can certainly contribute to our community and we can contribute to politics, but we don't have control over the overall politics in the world and large world events. We don't have control over the level of news that's put out there. And we can see that, recently and currently in relation to COVID, but you do have control over how much you engage with it, how much is enough to be informed, to be aware, to take action, and how much is too much where you're trying to control the outcome, where you might be trying to control how other people are or how they should behave, and then increasing your own anxiety levels. And you certainly don't have control over other people and how they think or their actions. So in a way, it's about acceptance or letting go or taking care of yourself and moving away from, if the actions are inappropriate to the situation that you're in, and just choosing what to do next. So in terms of window of tolerance, it's not about putting up with unacceptable behavior. It's about managing, de-escalating your own internal nervous system in order to be able to make the healthiest choice for you in any given situation, particularly a busy environment. So, for example, it's really helpful to know what are the type of things when you're in a busy environment, what basically creates that increased hyperarousal state where you might go into fight, flight, freeze, but you're reactive, you're irritable, you have no patience, you're trying to rush people on. So what brings you into that hyperarousal, that defensive state? Just noting for yourself, just getting some pen and paper, and perhaps even pause this webinar, get a journal, begin journaling. It's very, very helpful. And throughout the webinars, we'll explore different tasks which require that you actually write them down and support that change on a deeper level, because you can also refer back to it. But just noting in those busy environments, how would you know that you're in that hyperarousal state? How would anybody else know? What are the signs? So if you were to see a camera filming that, busy hospital or medical environment, how would you look in the middle of all that? So signs that you're there. Perhaps you shut down, in fact. Perhaps you wouldn't be seen. Perhaps you really close in. Perhaps you run away from the situation, or perhaps you confront others. Perhaps you manage to communicate effectively. But just notice when you're hyper-aroused, when your nervous system is really, activated, What are the signs that you're there? And importantly, what are the things that help you to move back into a sense of balance in yourself, a sense of emotional balance or psychological balance, where you can respond and create choices and make decisions from that centered sense of space, as opposed to maybe feeling tense and agitated when you're hyper aroused. So what are the things that you can do to help you? Do you need to ask for help? Do you need to delegate? Do you need a pause button for a few moments to consider your next choices? So just notice, is it a case that you need to say no? Is it a case that you need to say yes? But what are the things that tend to move you back into that window of tolerance where it's still busy, but it's manageable for you because you feel resourced? Knowing these, knowing what takes you there, knowing what supports you into that space, you can then draw on it when you're in these environments. And then, of course, for some, it's not about being hyper-aroused, or maybe you go from hyper-arousal to hypo-arousal. So what creates a sense of overwhelm for you, a sense of disconnect? What would be the signs that you have really checked out? You know, that you feel emotionally numbed out, to the point of shutdown, feeling maybe low mood, feeling this is really a bit hopeless and I really don't have many choices here. So what are the signs that you're in that space? Because of course, when we're in this space, it's very difficult to feel connected to others. It's very difficult to show empathy. It's very difficult to actively listen because we're emotionally shut down, and it can lead to a lot of, you know, lethargy and apathy. And again, when you're in that space, if you feel emotionally overwhelmed, very lethargic, very disconnected, what are the things that can move you back into that feeling of connectedness? You know, sometimes it's literally, you know, taking a space or even just noting that that's how you feel and saying, okay, what am I doing well here? What can I focus on that's going well in this situation? And also what would help me to feel better now? Perhaps it's a break, perhaps you've missed your lunch break, perhaps you've missed your tea break. So do you need time in order to actually re-energize on a very physical level? Just identifying your needs and what helps you to move back into your window of tolerance when you feel that sense of hypo-arouse or shut down. When we identify and when we increase that window of tolerance, we increase the space with which we can deal with very busy environments. So, for example, you know, our world hasn't become so small that we're caught in our own thinking, we're caught in our own behaviors, and we haven't literally pulled focus. It allows for the space that if you are under pressure, you have enough resources to manage that, and you're able to challenge unhelpful thinking styles, which we covered in the webinar on cognitive behavioral psychotherapy, CBT approaches and mindfulness-based approaches, to show how to change that thinking, to change and integrate supportive behaviors when you're feeling distressed. And you can look at that in the other webinars that are within this series, the Let's Talk series. So we can gain psychological flexibility by increasing present moment awareness, because as we saw, anxiety is characterized by future-based worry or regret orientation. And so having these abilities to be able to, having the ability to be able to come back into more present focus, the task at hand, what do I need to do right here, right now? Even for yourself, for the patient, for a colleague, just noticing what brings you back into present moment awareness. You know, when we have that ability to be able to tune into the here and now, we're less likely to get hooked into narrative around kind of communications with other people, or what we believe they think, or what we hope they think, or that kind of overthinking around things. It allows you just to be present to where you are right now. It also tends to, psychological flexibility grows from different qualities. And one is that ability to be able to focus on the present and to be able to read the situation as it is now, rather than inferring all sorts of assumptions about other people and ourselves, or the future indeed. It's about contacting our own values. So what's important to me right now, or what is the important value what are the qualities that I hold dear, that I feel are important, and how might I express them in this busy environment? So in other words, how do I not disconnect from my own values? What's important to you around patient care? What's important to you around your own self-care? And then committed action. So as long as we follow through on our own value systems in all the areas of our life as best as we can, because of course we can't be in balance 100% of the time, but as best as we can, we take actions that are based around supporting that overall sense of balance, which leads to fulfillment, which leads to psychological flexibility. And naturally, that's about tuning into yourself. So it's about becoming a reflective nurse, or a reflective midwife, tuning into our experiences and saying, reflecting on them. How did I do there? What do I need to learn from this experience? Was I happy with how I behaved or didn't behave? Was I happy with how I communicated or didn't communicate? And that can just take seconds, but it does give us, even on a bad day or a challenging day, it's kind of data collection. It's important information, particularly because if you behave a certain way in an habitual way when triggered in a busy environment, you're likely to do that every single time. So it is important that we're able to come back to ourselves and reflect on how we communicate, and also to tune into our own needs as well, especially relating to the ongoing experience of being in busy environments. And we can also do that by not engaging with lots of overthinking, so we don't get caught in the drama of feeling the pressure of this current environment. In fact, we can just observe, anxious thoughts are with me, or I'm noticing that I'm feeling very tense. So it's about noticing and observing and witnessing, rather than getting hooked into the narrative, the story behind the thinking, like she shouldn't do this, and if she hadn't done this, then this wouldn't have happened, and I wouldn't have. That's the narrative that we often get hooked into, and then moving further and further away from that psychological flexibility, we become psychologically rigid. When we're psychologically rigid, of course, it's very difficult for anyone to communicate with us, or for us to communicate with anybody. So another ability in this psychological flexibility is around the ability to elicit acceptance. So though we might be challenged by the environment, that we can accept that it is difficult, it is challenging, but these are the resources I have, or this is what I can do to support myself, or this is what I can do to support the patient or to support the colleague. So we increase present moment awareness with basically things like mindfulness or walks in nature or guided visualizations. And there's so many apps out there to support that. I mentioned in one of the other webinars about mindfulness that actually Beaumont Hospital have a whole section of their website which is dedicated to mindfulness, explaining mindfulness for patients, explaining when to use particular approaches. But there's a lot of information out there. There's the CALM app, CALM, or the Insight Timer app. And there's those very helpful, Insight Timer or Headspace app that can help you if you don't have a mindfulness practice or a guided visualization practice. It can help you just to establish how to do it, and then you can continue yourself. And that supports eliciting what we talked about earlier, the relaxation response, the parasympathetic nervous system, the rest and digest, instead of always going automatically into that more, amygdala survival brain part of our reactive self, which is the fight, flight, freeze reaction, which can be helpful in times of danger, but not so helpful if we're relying on it on a daily basis. Not helpful to ourselves, not helpful to those that we work with or take care of equally. So last year, in honor of the 200th anniversary of Florence Nightingale's birth, the US Nurses Association declared it as the Year of the Nurse. And the goal was to encourage inclusivity and participation of all nurses, including nurse midwives, in this landmark year to acknowledge nurses who, and when you look at it, nurses, as we know, and medical staff have been at the forefront of supporting patients and their families through this pandemic. So it's been a very significant time, and at times it's been a very emotionally charged time and a very physically draining time for people. And in addition to being very, motivating and obviously basically making the most of optimizing your contribution in the area, in the field that you've chosen to work in. But it's also important when you are giving in such a way, when you're supporting in such a way, that you do take the time to pause and check in with yourself and ask yourself, well, how am I doing in the middle of all this? Perhaps even reflecting over the last 6 months, how have I been doing? Do I feel better or worse? Just tuning in to maybe identify, because naturally there's a reason they say put your own mask on first. When we're flying, when we take flight, it's for the same reason. If you are taking care of yourself, there needs to be help for the helper. So if you are supporting patients and colleagues and staff, and perhaps, actually on an outpatient basis, you might be supporting people, members of the public. And if you're doing that, it's important that you have enough resources to do that. And that can help to tune into your own needs around self-care. So what is self-care? Well, as defined by the World Health Organization, self-care is the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare professional. So it's quite interactive, isn't it, in relation to our self-care. We need to become our own advocates of our own self-care. And self-care recognizes individuals as active agents in managing their own healthcare. And that comes from the World Health Organization's definition. So what are those indicators then? How would we know? And what are the signs of physical health? Well, I'm sure you know this more than most, but naturally there is that visual sense. So you can physically see, in relation to body composition, whether a person is within the normal range, and their waist circumference, and also naturally their BMI, their weight, so for their height, etc. So that's a visual sign of somebody's health, but it's not the only visual sign. Naturally, our posture is also indicates our overall physical health, our structural health, and our hair, nails, skin, and eyes, and gums, breath, and tongue. And in fact, in some natural health approaches, that's precisely how they are basically assessing. Naturally, in the medical approach, they will also be looking at the physical, visual indicators in relation to health or ill health, or indeed disease. And then functional. So what are our energy levels? If we have basically, if we don't have any kind of stress or anxiety, if we're not reacting to that stress and anxiety, we're much more likely to have better sleep quality. And of course, that sleep quality is so important, as we'll come on to. Thermoregulation, digestive function, and excretory efficiency is all contributes to the functional aspects of our health. As does fitness. So how engaged are you in your overall fitness levels? Your health, so essentially aerobic and endurance versus muscular strength versus flexibility and balance, and power and agility, because of course it's about having a variety of different approaches in relation to your physical health, as it is indeed for your psychological health, that there's many approaches, and it's important that you're not just sticking to one, which is working one part of your body, but not necessarily working the other part of your body. And biometrics, which you are, I'm sure, very used to in terms of noticing the resting heart rate, the blood pressure, lipid profile, resting glucose levels, and the mineral vitamin levels as well, and then blood cell count. So we have very much, there's lots of indicators as to overall physical health. And therefore, there's lots of areas that we can begin to focus on in order to support any deficiencies. And that can be helped by just taking a general overview of your own health inventory. So looking at, for example, a baseline assessment, your current health. How do you feel when we look at that last slide around physical health, but also you could look at it retrospectively over the last 6 months. That's very significant now in relation to various exiting of various lockdowns, and maybe looking at the last 6 months, how did your health compare now to then? Or you can take an overview of the last 6 months, and that will give you a general trend of how you are in relation to your physical or psychological health. So you can look at your detailed and technical, as we can refer to the last slide, your basic and general, and many of you will be very, very used to looking at those functional approaches and the biometrics of overall health. It's important as nurses that you also consider, in relation to the fact that you support a lot of people, do you also check into your own physical health and do those, blood tests, etc., and all those things that show maybe if we're deficient in any area. So how is your physical health, your visual physical health, your functional health, your fitness, and your biometrics? And then considering your mental and emotional health, how would you say you were 6 months ago, or how are you now compared to how you were 6 months ago? And that generally, when we look at our psychological and emotional well-being, we look at mood, our overall mood. We look at our ability to be able to perform and engage. And we also look at our sense of purpose. Do we feel engaged with our own values, a sense of purpose towards ourselves, and perhaps purpose towards our community, including our medical community? And so we can consider all the different areas of our life. So whether it's physical activity, movement, and flexibility. So we need those strengthening exercises, but we also need the flexible inducing exercises. And perhaps, are you happy with where you are now in relation to your physical activity? And what about your surroundings? Are you happy with the surroundings that you're in, both physically and emotionally? Maybe your home, or maybe your work environment, maybe the ward that you're in, maybe the clinic that you're in. And what about your personal and work life? So that sense of personal development, maybe CPD, continued professional development. Of course, these webinars are part of that. But what is important to you in terms of your goals for your professional life, and where are you now in that regard? Are you completely happy with that? Do you need to move forward with that? Those are areas just to consider. All of these things contribute to our overall sense of fulfillment, and therefore our sense of personal satisfaction, and generally contributing to our health also. When we're feeling balanced and fulfilled, we're more likely to nourish yourself. So it's important to take a look at your nutritional choices, your dietary choices. And would you say that you are paying attention to maybe dietary choices that are supportive around a variety of colors, a variety of food types, that we're including all the food types, but that we're actually not going for those processed foods as best as we can, that we're preparing meals in advance, etc., particularly if you're working long shifts. So looking at nutrition, and also how you recharge, particularly if you're on shifts. What about your sleep routine? How is your sleep routine? Because as we know, to recharge both physically and psychologically, we need that rest and recoup, and we need that sleep time to physically rejuvenate all the cells, but also to neurologically rejuvenate psychologically as well. We'll come on to that. And then in terms of your relationships, have you been able to have time for relationships, friendships, or perhaps indeed connections with co-workers or your family? So are you happy enough with the health of your relationships, or are you engaged in toxic relationships, challenging, conflict-driven relationships? Are there relationships that you need to maybe explore a little bit further, and perhaps find your own voice and also make your own choices around relationships maybe that aren't serving and supporting your needs right now? And that takes us on to our sense of purpose, our meaning and purpose. For some people, that's kind of spirituality. It might be meditation. It might be, religion, or it might be philosophical approach to life. But it's a sense of a deeper reflection around our own purpose, or what we'd like to connect to feel that we are evolving in our own kind of psyche, our deeper emotional felt sense, kind of our vision for ourselves, and connecting to others, connecting to ourselves at a deeper level. So we're not just functioning, we're actually reflecting, and we're taking time to pause and reconnect to our, I suppose, inner self, our deeper self. And then exploring our mind and our emotions. How would you describe your psychological health? And how would you describe your emotional health? Would you say that you can identify your feelings and you can identify your needs, and you're feeling emotionally connected to others, to yourself? And that's important to invest in our relaxation, invest in our healing in that regard. So when we look at the overall, then when we're feeling an overall sense of balance, we can do that with both prevention and treatment. We might need, it may be that part of our self-care is connecting in with medical treatment that we've been avoiding, or going to see a medical practitioner, or indeed it could be that we are seeking some support around complementary approaches, maybe having a massage, having a treatment, in order to support that sense of emotional balance, that de-stressing. It can be about how we contribute to our environment in terms of our professional environment. It can also be how we contribute to our community. So naturally, when we feel that we're in our optimum sense of overall wellness, we're going to contribute that, we're going to exude that towards others as well. So very important. So when we look at our overall, we can look at the current or retrospectively over the last 6 months to get a sense of overall what your baseline is in relation to your health. And then to recap, it's detailed and technical, basic and general. It's physical, looking visually, and also our overall, our weight, our BMI, our functional stats, our fitness levels, and our biometrics. It's our psychological and emotional health, our overall well-being, our mood, our sense of connectedness to others, our sense of purpose. So it starts with yourself. It's including your self-care. It's about honoring your professional care, what you'd like to do there, contributing towards your community, which we can only do when we're feeling that sense of balance ourselves. And that then allows for that overall sense of balance in our life and in our overall health and wellness. What happens then if we're out of balance, if we're feeling that actually I'm not feeling connected to others, I'm feeling stressed most of the time in this environment, I'm feeling overwhelmed, emotionally distressed, then it's important that we think about self-care and how to integrate that, or indeed lifestyle changes, or what support we might need on a social level, or on a psychological level, or on a physical level, and reaching out for those supports. So when we're in crisis, it's manifest by being very anxious or very low mood, and that can lead to absenteeism, a sense of emotional exhaustion because of that overthinking, and perhaps low serotonin levels. So that leads to real tiredness, a sense of emotional exhaustion as well. It can lead to physical pains and tension, or indeed feeling nauseous or sick. It can lead to migraines. It can lead to social isolation, which contributes then to depression. It can affect your sleep, both falling asleep and staying asleep, or it can affect weight. So it can lead to emotional eating and weight gain, or indeed the inability to eat because of that sense of nauseousness and those stress hormones running through the system. In the extreme, that can lead to a psychotic break, or hospitalization, or indeed alcohol or drug abuse. Our person might be struggling, anxious and depressed, with low self-esteem, so not feeling that they can undertake these tasks well, perhaps feeling tired and apathetic towards work. So that can lead to poor work performance and also poor concentration. lack of sleep, or again, appetite changes or problematic behaviors. Or it might be that you're not anxious and just feel just quite worried and nervous, something, that sense of foreboding, something's going to happen that's not good. So feeling edgy and irritable. And that can lead to a frustration and irritation towards yourself and others, self-doubt, maybe even sad and gloomy, distracted, difficult to focus on the task, and again, decreased social activities. And for any of these situations, it's really important to reach out for professional help support, which of course can be challenging because working in the medical profession, sometimes we can feel, oh, you know, I shouldn't be reaching out for support. I should be okay. I should be able to manage. So be careful if you're involved in that should cycle. And just ask yourself, if I was being a compassionate friend to myself right now, or indeed if a colleague, if a good friend and colleague who's also a nurse said this to me, that this is how they were feeling, what would I recommend? And can we allow ourselves the ability to receive help in the same way that we can give help? And then when we, feel that we're thriving or even excelling, we're much more connected, we feel fulfilled. Overall, we feel a normal mood, some fluctuations, but not those ongoing fluctuations. We feel calm and can feel confident in our ability to function well in the job, generally sleeping well and focused on our work. And that is also manifest in how our relationship with food and how we eat. So we're eating normal and generally normal social activity. We want to connect with others. We want to connect with family, friends, colleagues, etc. And when we're excelling, we're naturally cheerful, solution focused, and have high energy, you know, that energy from feeling fulfilled and motivated. So you're in much more of a sense of a flow, and you're realizing your own potential, and you can perceive your potential moving into the future. And what are the signs then of burnout? Because very often in nursing profession or other caring profession, there is those long hours. There can be long hours, and there is natural commitment to what you do. And if we're not offsetting maybe some of the stresses with some of those self-care routines, and sometimes it can be difficult to find the time to do that, but we do need to offset it. Otherwise, we may experience burnout. And for many, burnout seems to be quite sudden, but of course it isn't. It's a build-up of experiences that then overwhelms over time. And people can then manifest that either physically or indeed psychologically. Burnout can be defined as the feeling of just feeling overextended and depleted of emotional and physical resources. It leads to when you can actually do a burnout inventory, but essentially it explores emotional exhaustion, that sense of, and it defines it as emotional exhaustion, a depersonalization, a sense of disconnect from others. So you're going through the motions, but you don't feel part of it. And naturally inefficacy, because it's hard to be really good and producing really good work if you're exhausted. So it affects how we perform our tasks. Generally, the characteristics include physical low energy. It can lead to illness, fatigue, emotional fluctuations and dysregulation. Can lead to low mood or apathy, that sense of disconnect from, not interested anymore, not motivated anymore. It can lead to relational conflict because there isn't as much patience and there's irritability. It can lead to isolation, and perhaps we then feel like we're a victim. So we might use language like, you know, it's not fair, nobody considers me, I have to do all of this. So we then internalize this sense of victimhood. And it influences our performance. We don't feel capable and overall feeling demotivated. So you can see why it's really important, if you're in that space, to consider your overall physical and psychological well-being and to reach out for support and resources, and to consider all those areas that allow for that including rest and recoup. And that takes us on to the rest and recoup that we need in terms of sleep. So how do you establish, and why is it important to establish a good sleep hygiene? Well, the benefits include basically it supports the endocrine system, which helps to support hormone balance. And when we look at the statistics, 1 in 6 people worldwide are affected with fertility related issues. And so, it can really help to, have that overall sense of physical health, and also benefiting from hormonal balance. There's many things that can lead to hormonal imbalance, and it's only one factor in relation to issues relating to the endocrine system and indeed relating to fertility. However, sleep really does help to benefit the endocrine system. It also helps to benefit brain function. So naturally, when you're driving down the motorway and you see the signs, pull in. If you're tired, that's because our sympathetic nervous system doesn't react as quickly when we're feeling very exhausted. So it basically is important for our brain function to have sufficient sleep, sufficient rest. It supports balanced decision making, and also when we're releasing stress, in terms of the hippocampus, it's important that as we're releasing, if we release a lot of stress hormones, we're also affecting the ability to our memory, because it's also responsible for short-term memory. It recalibrates our emotional center. Our prefrontal cortex is concerned with emotional reasoning. It's also the part of our brain that connects into creativity, actually, and emotional reasoning, and just a sense of being able to have a perspective on things. And that's supported again with a good night's sleep. Not more than one good night's sleep, but many good night's sleep. So, it's important, like, as we know, sleep deprivation has an impact on our physical and psychological health. It reforms our metabolic state by balancing insulin and circulating glucose, and that helps to regulate appetite. So you're less likely to go into those big fluctuations of wanting to eat something really quickly, processed food usually in that situation, because of the low blood sugars. So the body generally enters a state of homeostasis, that balance. If we have a good sleep routine combined with all the other areas that we discussed, including nutrition, including exercise, including psychologically being able to challenge unhelpful thinking styles. The parasympathetic nervous system moderates itself during rapid eye movement, sleep, and also maintains the body, while the sympathetic nervous system also regenerates. So both systems, which we rely on, essentially regenerate. And it also helps to fight infection as it boosts the immune system. And as we know, we all want pretty efficient immune systems these days, right? So sleep habits, when they were exploring some of the sleep habits and the susceptibility, for example, to the common cold, they basically did some research with 153 participants, and they were exposed, drip exposure to rhinovirus, the common cold, over 14 days. And those with less than 7 hours sleep were 3 times more likely to have clinical symptoms compared to those with 8 hours. So just actually increasing our sleep only by 1 or 2 hours can make a huge significant difference over time. And so having a self-care plan is about, it can contribute to better sleep. It can also contribute to overall health and wellness. First of all, creating a sleep plan includes, especially if you're working on nurses with, say, working shifts, creating a sanctuary. So your room shouldn't have your computer and your phones and all those electronic devices in it, but ideally has blackout curtains, specifically if you're working shifts as well, and that you have so that the room is decluttered, so that you're not distracted, and also that it's the right temperature for falling asleep and staying asleep. If you do have Basically, you can have some of those, those speakers that you can prompt, and you can actually play one of your guided meditations if it's linked into your smartphone. If you have to have your smartphone there, then basically play the guided meditation. Something like the Calm app have good mindfulness or sleep-inducing meditations, and then turn your phone over so the blue light is not affecting the melatonin secretion, which is also important. It's important that we reduce mind-body stress, because whatever we're taking into our body, and also how we're talking to ourselves, if you wake up and then you're really agitated and then you think, oh gosh, I have to sleep, I don't sleep, I won't be able to do work properly tomorrow. And if we basically agitate ourselves in that way, we're more likely to release, of course, adrenaline, stress hormones, and keep ourselves awake. So being conscious of what we ingest, but also how we talk to ourselves, especially if you wake up. Maybe journaling an hour before bed can really help if you have a very active mind. Changing your thinking, as I said, allowing, if it's okay if you don't sleep too well, it's not ideal, but you say to yourself, okay, it's not ideal, but I can manage it. I've managed before, rather than going, oh my gosh, I have to sleep. However, it is important that you establish a healthy routine. So, for example, that if you go to bed before 12, if you go to bed around 10 or so, it's much more beneficial than going to bed after 12 and having less sleep and getting up early for an early morning routine. So being mindful, not just how much sleep, but when you fall asleep. And then if you're working shifts, that you would repeat, you would mimic, you would basically say, okay, if I wanted this 7 or 8 hours sleep, what needs to be in place here? Probably having a small snack, changing into comfortable clothes rather than lounging in front of the television, or doing active exercise before you go to sleep. It's important that we do have exercise, but that we do the active exercise in the earlier part of the day, and then that we have the more kind of mindful walks or walks in nature, or just a slower exercise in the evening, which allow us to let go of overthinking, but don't overactivate, don't stimulate the body too much. It's important that we keep in mind our nutrition, our dietary choices. They can either agitate our body, or also, as we know, if we take in too much caffeine, then that's going to, or alcohol, that's going to affect sleep also. And perhaps sometimes it's about taking supplements just to support you. So for example, some people take melatonin supplement, which needs to be prescribed by the GP in order to get into a pattern of sleep. And then, or they might take, vitamin B complex or magnesium, known as nature's tranquilizer. So it depends really. It's about assessing that with your GP or assessing that with your natural health practitioner. But there are supplements that can also support, in terms of calming the nervous system, can support you with that. And then creating that point, that choice point, to decide that I actually do want to increase exercise, or I do want to get more sleep. And what am I going to do that's different? And what are the things that are likely to pull me away from my goals? How am I going to encourage myself to continue with my goals? And how will I challenge maybe unhelpful thinking or beliefs when they crop up, and having an alternative internal dialogue ready to support you through that. Sometimes it's about being accountable. So it might be that you do the exercise with somebody else. As we regroup and join groups again, it can be really motivational to go to a group class in terms of exercise, because you're more likely to have that sense of camaraderie and support there. In terms of dietary, step 2 of our 5-step plan. In terms of dietary behaviors, it's about optimizing nutrition, and particularly in clinical settings, that you're ensuring that you're hydrated enough. There's a lot of air conditioning, etc. So just ensuring that you are keeping hydrated, but also that you're optimizing the increase of fruit and vegetables. As we all know, I mean, historically, it's been 5 fruit and vegetables, but I'm sure the nurses that are also supporting in nutritional areas will also know that's increased now a lot, from 5 to 7. So it's about having lots of color, lots of variety, and also, where possible, not having these processed foods, these aggravators, which we can tend to grab very quickly when we're in a hurry. So perhaps having snacks that are things like Brazil nuts or carrots with hummus, and having them pre-prepared if you can bring them into your working environment. These days that can be a bit limiting, but having those snacks that are going to allow for that balance of blood sugar, so that you're not getting over hungry and then or creating these fluctuations with highly processed foods. And if you are in that busy environment and you want to, keep your blood sugar balance, it's important that you pay attention to eating small meals or snacks every 3 to 4 hours. So that, and eating even, when you wake up, not sort of rushing out and avoiding your breakfast, because it's called break fast for a reason, that we should eat within the first hour of awakening to create that balance. Eat before becoming hungry. As we know, when we're really hungry, we're much more likely to basically grab something that isn't exactly nourishing and not maybe supportive, but also you allow yourself to run out of that fuel. So you become, low blood sugar levels, hypoglycemic, perhaps in the extreme, and just difficulty concentrating, etc. So paying attention to healthy snacks can really support you through the day and support those challenging environments as well. So that you're not placing additional stress on the adrenal gland, that you're paying attention to healthier choices around energy efficient, supportive choices as well. Some dietary approaches recommend that you take out a particular food group, and that's really, as we know, not a good idea. So it is important that we include our protein, our complex carbs, our lots of vegetables, and also it does affect our mood. So in one of the largest studies ever conducted on food and happiness, researchers collected dietary data from 80,000 people in Great Britain. Those who ate more fruit and vegetables, 7 to 8 servings a day, reported much higher life satisfaction. Of course, you're talking about getting then all the minerals, all the amino acids that are needed. And this was after adjusting for the variables, including employment, marital status, income, education, and illness. And so when we pay attention to our mind and body approaches, we're basically taking care of our overall health. And just generally, if you're interested in food and psychological, emotional health, there's a lot out there now. I think Stanford University actually very recently did some research about the gut and the influence between gut health and psychological health. So there's a lot out there now around gut health, around our choices of our food and nutrition, and how that influences our physical health, as we know, but also how it has a relationship with our psychological and emotional health. In terms of exercise, then, it's important that we have a variety of exercise. So aerobic exercise, at least 150 to 300 minutes of light to moderate exercise, 75 to 150 minutes of vigorous exercise, and then building up that muscle resistance training. It's moderate intensity or greater muscle strengthening for all the muscle groups, 2 or more days. And that can also be supported if you're not a fan of building and resistance training. You can do actually particular yoga approaches as well, will also be considered in terms of creating that resistance training effect. So you're building your muscles, you're building your flexibility, and then you're combining that with aerobic exercise. Importantly, and the most important piece, is that we limit the amount of sedentary time throughout the day. And as we all know, in the work and lives of nurses, there's not much chance of that sedentary behavior, but just limiting that. In terms of step 4 then, present focused practices. What can you do to support yourself to feel less overwhelmed emotionally and to help to elicit that parasympathetic, elicit that sense of homeostasis balance, both psychologically and physically? Things like meditations are present focus practices, or breath work. Again, there's a lot of work now around the impact of slow breathing on our nervous system and how it benefits it. So basically it makes sense, because if we're breathing slowly in through our nose and releasing slowly out through our mouth, well, we're probably not being chased by a bear or witnessing a snake or any of those things that we would have had to run away from. So slow breathing, the regulated slow internal intake and external breathing actually has an impact on it elicits our parasympathetic nervous system, our rest and digest. Things like yoga, Tai Chi, Qigong, and martial arts all combine breath work with body movement, which of course supports that sense of strength, flexibility, but also that a sense of balance internally and that sense of calm. And if you build those resources, you're less likely then to be reactive in those chaotic environments or stress environments. Mindfulness, again, is an approach which suits many, not all, but mindfulness-based stress reduction are approaches to support yourself to be very present, focused, and to observe, become a witness to your thinking, become a witness to how you feel, become a witness to the sounds around you, but not necessarily engaging in the stories of the mind. So what you might be saying about another, what you might be thinking about, you just observe that thinking and take the attention back to the here and now task at hand. For some people, they're very much enjoying the latest cold water immersion in the sea and doing that cold water swimming. And of course, actually, there's a physical benefit to that because it tones the vagus nerve. So it essentially impacts on our psychological health as well. As does singing, and basically present focused activities tend to support that overall vagal tone, which is directly linked into our nervous system. Perhaps you need to speak with a therapist or a facilitator, a life coach or psychologist or counselor if there's something that gets triggered in terms of how you react in a high pressure environment. How do you react? Is it similar each time or very often in a way that you're not very happy with? Perhaps you feel that you're over assertive, or perhaps you feel that you're too passive. And very often these things, these relationship ways of communicating can be influenced by other relationships, that can be influenced by earlier relationships and beliefs that we might have basically established then. So exploring that in a deeper level can help to bring awareness to those aspects of ourselves, and also can help to contribute to change if needed. So tuning into employee assistance programs or occupational therapist support, or any one of those, or your GP, tuning into that support, maybe even identifying your needs and linking in with the other webinars to support an overall understanding of what will help you psychologically and emotionally and physically. Creativity and music and dance are other ways to be able to let go of anything to do with our professional environment, work environment, and to bring that sense of present, focused attention, that sense of calm, that sense of joy and fulfillment and connection. And step 5 is really about creating a choice to change. So how do you bring about these changes? First of all, it's identifying the areas that we explored earlier that you might think, oh, I really need to focus attention in a particular area, whether it's family or friends, or whether it's your CPD, whether it's your professional approach, whether it's your own physical health. But first, we don't necessarily engage with this exercise is an example, but it could be anything, it could be your psychological health. So we may not necessarily pay it much mind, and we may have no intention to create any change. And then we move into the contemplation stage, where we're thinking, actually, I'd like to exercise, but I might take action in the next few months. Maybe not now, but a little bit later, so that you go from pre-contemplation, not thinking of it all, to really mulling it over and considering it. And then the third part of the intentional stage of creating that intention for behavior change is the preparation. So now you might start exploring, looking up different support Perhaps you're looking up a gym, perhaps you're looking up a yoga studio, perhaps you're looking up one-to-one support physically, or maybe you're actually looking for psychological support. So this is the preparation where you do your research, and maybe you buy the outfit, and maybe you might even join the gym, but you haven't quite gone yet. Then there's the action part of our behavior. This is where you exercise, and you exercise consistently, but maybe less than 6 months. So it's not a habit formed for an ongoing basis yet. It's important that we maintain that, so that we say, overall, what can I think that I can achieve with this busy work environment, with maybe other responsibilities that you have, perhaps family, perhaps friends, etc. So how can you make, what's maintainable, what's most likely that you will sustain, rather than taking action on saying, okay, I'll go to exercise 7 days a week. And then perhaps that really won't happen because you can't fit it in. Then you miss 1 or 2 classes, then you start an internal dialogue that doesn't support you, and then you don't maintain it. So it's important that you think, okay, overall, what would challenge me out of my comfort zone? What do I want to change? But also, what is most likely a number that I can maintain? And then that, and also if you do it with somebody or as part of a group, you're much more likely to stay with the course. You're much more likely, whether that's dietary changes, whether that's going for, psychological support. If you actually say it to somebody, if you reach out, you're much more likely to show up then for those appointments. Or indeed, if it's exercise that you might decide that you'll do it with a friend, or go for a walk in the evening with a friend, etc. So we have our behavior intention, and then we have the activation, and then we have the maintenance. So creating that choice point and exploring overall where are the areas that you'd like to create that change to offset any kind of stressful experience in those busy environments, that you can create that balance and bring that balance in. So thank you for joining myself and Bracken as part of Zevo Health. And also just to bring your attention that there are lots of webinars in the series which are about supporting your emotional health, supporting your psychological health, and also supporting your physical health and well-being. They are specifically aimed at supporting nurses and midwives, and you can access them at the Let's Talk About It link just below this. And it's brought to you with Cornmarket, INMO, and Zevo Health. Thank you for joining me today. Bye-bye.